Hello everyone, welcome to my YouTube channel. This is Dr. Sankari Kasi. Today we are going to discuss about a common as well as a very interesting topic, which is hair loss in men. I also have a separate video for hair loss in women, and they can also benefit by watching that video. If you have not subscribed to my channel, make sure to subscribe to my channel. Let's get into the video. So when someone comes to us for hair fall, so usually we ask them about their healthy scalp, because sometimes there could be presence of dry skin or dandruff or dry thick patches in the scalp, and that can also causes a lot of itching, and that can also cause them the generalized hair loss. So make sure that you talk with your provider and address the dandruff, and then that can also help you preventing this hair fall. The other reasons would be either the blood test. I usually recommend them to get a complete blood count, which includes the hemoglobin, which will let us know that whether the patient has got anemia or not. And also definitely we have to check their iron as well as the ferritin level. Usually anemia is less common in men, it is more common in women, but still if the iron or ferritin is low just because their nutrition is not supporting iron rich diet, and if we can fix that, that can also help them with their hair fall. The third important one is the thyroid hormone. So make sure you have your thyroid hormones checked, and if that's abnormal and if that's being corrected, the hair fall will get a lot better. So let's look into two other less common causes before we jump into the main cause, which is a male pattern type of the baldness. So the less common one is telogen effluvium. So this is most commonly happens like 3 to 6 months after a stressful period, or if someone is going through like a major illnesses, they might have like a generalized hair fall, which may happen after 3 to 6 months. But don't worry about it, this might resolve on its own, or if the primary reason is fixed, for example the stress or the illnesses is taken care of it, and that will resolve on its own. So that's about the telogen effluvium, and let's jump into the next cause, which is the alopecia areata. So this is like a patchy hair loss. If you see there could be a circular patches of hair loss in multiple areas of the scalp. Maybe it could be a single spot or multiple areas for that. For that, make sure that you talk to your provider, and they'll be able to give you some injections, especially the steroid injections or a steroid cream that you can apply on that, and they'll also help you to stimulate this hair growth, and which is also treatable. So make sure to see your provider for that. Next is the one which is the androgenic alopecia, which is the male pattern type of the baldness, which is very common. I'm going to discuss about what are all the FDA approved medications for the male pattern type of the baldness. Number one is Minoxidil. So the Minoxidil is applied as the liquid formulation, or it can be taken as the oral medication for that. So the liquid formulation of the Minoxidil, so in a large clinical trials, they found out that the Minoxidil helps you with the hair growth. It also strengthens the hair, and it also proven that it also reduces the hair fall. It can be safely applied, so you can use it either in the form of a foam, or you can apply that as a liquid. Take that in your fingertips, apply that and massage that into the scalp. Either you could do it 2 to 3 times per week or every other day. In the first few initial months, maybe 2 to 3 months, you may not see the benefits of the medication, so don't give up. Apply that consistently, and after 3 or 4 months, you will feel that you could see a visible benefits that it prevents or it also lowers your hair fall. And side effects, I may say, some of them may say there could be some slight itching or irritation in the scalp, but there's not majority have side effects. It's a very well tolerable type of a medication. And then the one which is available over the counter is the 5% of the Minoxidil, which can be applied for the hair fall. So the next information is the Minoxidil, which is also available as an oral form. So you can take it orally, but you have to also remember that it is also a blood pressure lowering medication. So make sure that you talk to your provider to find out are you on the right medication for your hair fall. Make sure that there are no drug interactions with other medications, and make sure your blood pressure is also normal before you get started on with the oral Minoxidil. So what happens when you stop the Minoxidil? So when you stop the Minoxidil, you might feel that you are losing the benefits, and also you might feel that there is more shedding of the hair. So think about it before you start the medication, and also think about it before you stop the medication. So these are all the benefits of the medication, which is the Minoxidil. So the next medication which is FDA approved for hair loss in men is the Finasteride. So this medication is very promising, and studies have shown that 80 to 90% of the hair fall, the Finasteride medication has been helpful for that. So this is a very promising medication, but make sure that you talk to your provider to find out is this medication is the right choice for you, and also make sure there are no drug interactions with the other medications. So this medication has to be taken every day, and after 4 or 6 months you will be able to see the full benefits of the medication. And the same thing, when you stop the medication you feel that there is more shedding of the hair, but their benefits are very noticeable, especially if you take it more consistently. So the other cosmetic dermatology options for hair fall in men is the laser therapy. You can talk to your cosmetic dermatology provider regarding that. And then another option is PRP, which is a platelet-rich plasma. So what they do is they take your blood and then they separate the red blood cells from the plasma, and then they take the plasma and then they inject into your scalp, and that can promote your hair regrowth. This is also done at the cosmetic dermatology setting, and make sure you talk to your provider regarding that. And then the last option would be the hair transplant, which is a permanent hair growth solution that you can also talk that with your cosmetic dermatology provider. So in general and overall, I would recommend you a healthy diet, which is we call as a rainbow diet, which is mostly the different multiple colored vegetables and fruits, and also make sure that you take this whole grains, nuts, legumes, protein, as well as low fat, as well as a low carbohydrate diet. So the more the healthy as well as a different variety of your plate looks like, that will also help you with the hair fall, and also get those labs done, and make sure to take care of your scalp, because if your scalp is more healthy, that can also prevent your hair fall. I hope this video is helpful for many of you out there that we discussed about this hair fall in men, and then I will see you all in my next video. Make sure to subscribe to my channel. Thank you for watching.